Yeah, so my name's Davenport. I'm a trauma and vascular surgeon from the Royal London Hospital and Queen Mary University of London in London, in the United Kingdom. Well, as a trauma surgeon and vascular surgeon, one of the most important things for me, and certainly through my training that my mentors have shared with me, really is keep things as simple as possible and absolute attention to detail, particularly when you're dealing with lots of bleeding, both electively or in emergency surgery. It's really trying to be very careful throughout your entire operative field, but also in your assessment of patients, really attention to every little detail, because that's the difference between a success or a potential complication. Well, I think you're going to find lots of people during your career that will say you can't do something, or that they wouldn't do it like that, and you have to just work around those people, because if you feel passionate about something that you're doing, there will always be somebody that shares your passion, and you just have to find those people, because those are the people that have inspired me and allowed me to ultimately become a consultant surgeon. So I'm talking about traumatic coagulopathy. That's my particular research interest, and we've been doing a lot of work over the last 10 years trying to understand the mechanisms of why patients bleed so much following major trauma, and also around how we resuscitate those patients. So some of the messages that I'll be presenting today around pathophysiology and some of the work around how we develop new treatments, and also in the session there'll be talks around damage control resuscitation, how we use earlier blood product ratios, and how that really has achieved significant outcome benefits for our trauma patients. So I think basic science is very important, because it's the fundamentals for everything that we do in clinical medicine. I took some time out and actually did an integrated Bachelor of Science to study in some more detail, and then following, or midway through my training, I then took time out to do a PhD. And I think anybody should have a basic understanding, absolutely, but also a more enhanced understanding will enrich your practice, because you'll develop specialist interest and hopefully research interest as well to push the field further forward. So the NHS in particular is going through tremendous change at the moment, primarily around funding, but I think as we move to be more efficient, alongside of that will be better ways of treating patients. And just in the same way that some treatments, surgical treatments that were around 50 years ago, we won't see anymore. For example, the role of proton pump inhibitors have completely changed our way of managing ulcers, and I should think we'll see many more of those developments. In my particular field, though, I think in trauma surgery there'll always be a need for open surgery, so having good general surgeons still is going to be paramount to keeping our trauma patients alive.
Great, thank you for your time.
Okay.